Today I'll be doing the neurological video. I have my patient here. First, I would introduce myself to the patient. Hi sir, my name is Jessica and I'll be your nurse today. I would like to do a neurological exam on you. Is that okay with you?
Yes, it is.
So I have his consent. After I have his consent, I would make sure to check his ID band for, make sure that this is the correct patient. And I would ask him what his name is.
Robert Cloud.
Okay, and do you know where you are today, Mr. Robert?
Yes, I'm in the examination room in Bridge City.
Okay, and do you know what day it is?
Today is December the 4th.
Okay, and do you know who last year's president was?
President Trump.
Okay, good. So the patient is alert oriented ×3. I would make sure to provide privacy, wash my hands before beginning the examination. So first I'm going for the neurological exam. I'm going to check mental status. Speech is included, but we don't really check that so much in this course. Motor, sensory, and reflexes. Okay, so first I would check. Overall, I would observe and inspect. See if I see any noticeable neurological factors right off the bat. And he looks pretty healthy as I can see. So first I would check cranial nerve number 1. I would ask the patient to close his eyes, please. And I would ask the patient what he smells.
Chocolate, I think. Coffee.
Okay, it is coffee. So cranial nerve number 1 is intact. Next, I would grab my ophthalmoscope. Don't have one, but I do have this otoscope. So I would do my best and pretend. For the cranial nerve number 2, I am going to shine the light. If this was an ophthalmoscope, I would shine a light and look into his optic nerve, okay, in both eyes. I would look and look. Okay, and I would see that both of those are intact. And I forgot my pen light. 1 second. I do apologize about that. Next, I would check cranial nerve number 2 with my pen light here. Okay, so I'm going to have the patient look. I said cranial nerve number 2. I meant cranial nerve number 3. I would have the patient look away, or not really look away and move his head, but really focus on something in front of him. And I would shine the light into one of his pupils and look for that constriction. Okay, and after that is done, I would then check cranial nerve number 4. I could either use the tip of my pen light here or use my finger. And within his focal radius, I would ask the patient to just follow my finger with his eyes. Okay, and he does that very well. And then I'd also ask for the patient to follow my finger while I bring it inwards to his nose. Okay, and that is intact there. Next, I would check the motor function of his jaw, cranial nerve number 5. Okay, so I would put my hands on the patient's jaw, and I would ask him to move up and down, and clench, And the jaw, the masseter muscle is really tight there. That's good. Okay. Then I would ask the patient to, this is cranial nerve number 6, I believe. So then I would ask the patient to frown for me, smile, okay, stick out, blow your mouth like this, okay, and he can do all of those things, so great. Next I would go for my hearing test here, okay. First, I am going to do the whisper test actually before I use my tuning fork. So I would simply ask the patient to close one ear, and I would whisper a simple phrase in the other around the other side to see if the patient can hear. And what did I say? And what did I say?
I couldn't understand it.
Okay, so I would further assess this patient for, I would further give this patient some assessment for hearing. He did not pass the whisper test. Next, I would do the Weber test here. Okay, so I would strike the tuning fork and I'm going to place it at the patient's forehead here. And I'm going to see if he can hear from both ears. So. Can you hear out of both ears, sir? Hold on.
No. Yes.
Okay. Okay, so he said yes. That's great. So then I'm going to move forward to the Rin test. Do the same thing, strike my tuning fork, and I'm going to come behind the ear on that bone right here.
Mm-hmm.
Okay.
Yes.
Okay. Also, I would do it in front of the ear as well.
Mm-hmm.
Okay.
Yes.
Okay. So he did pass the Weber and the Rin test, and I'm done with my tuning fork. Next, I would assess, let's see, cranial nerve number 9. I would move it down to the mouth. I would ask the patient to open wide and say, ah. With my pen light, I'm looking at his uvula. Say, ah. Okay. So I see that the uvula goes up, which it should for that test there. Next, the next cranial nerve I'm testing would be with the mouth. I would ask the patient to open his mouth and stick his tongue out. Move it side to side. Okay, there, good. So if he were to have a cranial nerve injury there, then he would most likely, his tongue would deviate to the side of the injury. Okay? Next, I am going to test his spinal accessory cranial nerve number 11. So doing so, I would place my hands on his shoulders and ask the patient to shrug up. Shrug, please.
Ma'am?
Shrug your shoulders, please. Okay. And I'm going to push some resistance. If you can, look to the left. Try to move your head to the left. There you go. And the right. Okay. Good. So that cranial nerve is intact. Okay. Next, I would check the. Next, I'm going to move over to his motor function. Okay, so the patient, whenever he actually, I'll have the patient go ahead and stand. And sir, can you please just walk forward normally? Okay, and turn around and walk back. Okay, good. Now turn around. He has normal gait. I don't see any issue there. Next, I'm going to have him walk heel to toe like this. And this is the tandem. Can you do that, sir? Good. Now turn around and do the same. Perfect. All right. Now turn around, sir, and stand right there for me. Okay. Well, actually, I can have you. Trying to think here. I can have you walk on your heels. Good. You can stop and back up. Can you walk on your toes? Watch your head. Okay, good. Can you bend your knees? Up. Is that painful?
A little bit.
Okay. Go ahead and have a seat for me, sir. Okay, so next I would check for any type of muscle atrophy that I might, find here. I would just lift the patient's arm this way. Just let me lift it, sir. This way. Okay. I would look at his hands too for muscle atrophy. Normally, muscle atrophy you can see starting in your thumb area because that is where we have our biggest finger muscle there. Okay, so I don't see any noticeable atrophy. Of course, I would look and inspect his legs here, okay, and the other leg. Okay. Next, I'm going to move on to muscle strength. So, I'll have the patient put his hands out for me, sir. Okay. Actually, before we move on to strength, sir, I'm going to have you... Actually, no, I changed my mind. Let's move on to strength. I'm going to have his patient stick out his hands. Okay. I'm going to have you close your fingers. And push up, out, try to open your fingers. Good. Now keep them open and try to push in. Or try to stay open, I'm sorry. Good. Okay, perfect. He has very good strength there. Now take your fist and push up for me. Just with your fist, sir. Okay, good. Now don't let me push down. Good. Okay. Now I'm going to test the elbows. Push for me, sir. Okay, good. Now pull back. Okay, good. Now the shoulders, short arms out, sir. Don't let me push down, okay?
Yeah.
Okay, now don't let me push up. Okay, good. So this patient has really good strength, okay? Next, I'm going to move down to the lower extremities here. Okay. I would go to the feet, okay, and I would ask the patient to, sir, will you? I know you can't see, but I have the patient's feet here. Sir, will you please try to push up your toes for me? Okay, and push down. Good. Okay. I would check for flexion and extension, abduction and adduction here. Okay. I would ask the patient, sir, can you move your feet like inwards and outwards? Okay. Okay, good. Now, with your legs, push up. Let's do both of them at the same time. Okay, now push down. Okay, so the patient is very strong in his lower extremities as well. Okay. Next, I would do his hips. So I would have the patient lay down. Okay, so I would have the patient, sir, can you raise your, from your hip, can you raise your leg? Okay, good. Can you raise your other one? Good. Okay, now bend your knees, please. Okay, other one too. Okay, now try to push out against my legs, my hands. Good. Now in. Good. Okay, so the patient has very good motor function down in his lower extremities. Okay. I would also have the patient, if I had him on a flat bed, I would have him turn to his side and raise his legs sideways. Okay, and test that abduction, adduction, hip movement there. I'm going to sit the patient up. Okay. Now, sir, if you feel okay, would you please stand for me?
Mm-hmm.
Will you please close your eyes and stick your arms out for me, sir? Straight out. Now just stand there. Okay, now I'm gonna push on your arms, okay?
Mm-hmm. I'll let you push?
Yes, you let me push. Okay, good. So they go back to where they were originally. Also, when he's standing there, I don't see any type of movement or deviation, so that is good there. You may sit down, sir. And that was testing the Romberg test, okay? Next, I'm going to, and the pronator test as well. Okay, sir, next we're going to do, I want you to have your hands here on your lap.
Here?
And then go slap, 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 quick, slap, slap, slap. Okay, good. The patient can do that without any difficulty, so that's good. All right, so next we are going to do and forgive me if I'm pronouncing this wrong, and I cannot think of the word today, but I'm gonna have the patient close his eyes and open your palms for me, sir. I'm gonna put something in your hand and you tell me what it is. Tell me what you think it is. You can close on it.
Feel like maybe a opener or something?
Another one?
Earring maybe?
All right, well, we're gonna have to retest that or send him for further evaluation because that was definitely a key that I put in his hands.
A key?
That was a key.
I could have maybe got it after 2 or 3 more guesses.
All right, so sir, can you please keep your eyes closed, but you can relax your hands? Okay, so next I'm testing for his sensory in his lower extremities. Of course, I would do this on open skin, okay? Can I lift up your pants leg, sir?
Mm-hmm.
Okay. So you tell me if it's sharp or dull, okay? Sharp or dull?
Dull. Dull. Dull.
Okay. Close your eyes. What is it?
Dull. 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 Dull.
And then I would do the same thing on his arms
With my eyes closed?
with your eyes closed.
Dull. 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 Sharp.
Okay. Okay. And the other arm?
Dull. Sharp. Dull. 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 Dull.
Okay. Alright, so the patient has a little bit of trouble differentiating between the sharp and the dull sides. Okay. So I would, you know, I need to further assess his lower extremities as well, because I do note a little bit of dryness and a little bit of swelling down in his lower extremities. All right, so lastly, I'm going to check this patient's deep tendon reflexes. Okay, first I would check his brachioradialis. Okay, that one is intact. Then I would check his biceps. Okay, that one's intact as well. Then I would check his tricep. Just let me hold your arm, sir.
Okay.
Okay. And then I would move down to his knee. And I would actually have his leg dangle for this, but I don't have it right now dangling, but I would find where I need to assess. And I would normally see that leg, you know, kick if it was just free dangling. Okay. All right, so that concludes the neurologic exam. I would make sure that I document, make my patient comfortable, wash my hands, and that is it. Thank you so much. Thank you, sir.
Yes, ma'am.